We're talking to Bill Bowtell, former government advisor to the then Health Minister Neil Blewett a number of years ago now. And he is talking to us about the challenges that government at all levels is facing with COVID-19. But Bill, what I want to run past you now is, as you touched on earlier in the conversation, you said our messaging was mixed. New South Wales and Victoria fell off that very disciplined approach that not only New Zealand took, but a number of the other states in Australia. They locked down straight away. We kept hearing that the borders couldn't close between Victoria and New South Wales. There was a lot of resistance. I dare say business didn't want the inconvenience of having to stop for hours on the border to get through. What did they need to do that they haven't done? And what can we, going forward, what must they do now? And who's the one that should be leading the charge? Is it the Prime Minister? Because we're finding out that Federation of States in 1905 and that perception that we have in our minds about who runs Australia is very, very different, isn't it?
Well, things have changed a lot. We're not going back to the world that we left in the middle of March. I think we've got to accept that world is gone. The economy's going to look different. The way in which we interact and work is going to look different. And we've just got to come to terms with it. We can't be nostalgic for what's gone. We've got to get on with the building of this new set of arrangements. But right at the moment, we have almost 500 new cases a day in New South Wales and Victoria. Now, we cannot allow that to get out of hand. It would be a disaster if that were to increase rather than be brought down. Now, the only tool we have is behavioural change. You've got to keep social distancing. As we know, you've got to use masks when you're out and about, and you've got to do hand washing and so on and so forth. Now, all of that requires everybody to take responsibility for changing their own behaviours. And we know that needs really saturation, really good, effective communications. You're a communications professional. You know that you've got to keep the message simple. You've got to repeat it. You've got to bring the people with you. This won't happen from the top down. The top people, Prime Minister, the Premiers, they've got to fund big to get that message out, but it's got to be out to all the various communities in Australia and to young people in the ways that they understand, that they respond to, brought to them by the leaders, the people that they respect and admire, and whose advice they will follow. So communications is key to the elimination of coronavirus, and we've got to do a lot better than we have. It's been very humdrum, very mediocre, not much of it. And obviously, as we can see in Melbourne and Sydney now, the proof of the pudding's in the eating. It's not worked very well. People are not doing what they should, and that's because the communications is not as good as it should be.
Surely people were watching what was happening in Italy. Surely people were watching what was happening in France, in Spain, in America, where the toll continues to climb. And again, we readily don't appreciate that there are 350 million Americans, and a great many of them are struggling in a divided country that is preparing itself for a new presidential election. So there is amazing messaging, but I would have thought the strongest images for everybody in this world of ours where we no longer read, we process everything through pictures, I would have thought we'd get the message by now. But it seems to me that, again, old habits take an eternity.
Yeah, well, if everybody got the message, we'd be in a better position than we are in New South Wales and Victoria. So clearly something's not going right with that messaging, and you're right, it's visual. But, you know, a lot of people, younger people particularly, they don't watch the evening news bulletins. They don't watch free-to-air TV as we do, and read newspapers. You know, newspapers, what's that? It's on TikTok or Instagram or all the other social media channels, and they've got to get a consistent message all the time. Now, clearly, in the last few weeks, the consistent message should have been use masks. Why do you use masks? Show that visually, and do that all the time, because the virus will find the weakest link. I think most people, as we saw with the lockdown, I think people understood the reason for the lockdown, and they did tremendously well. I mean, we got it down to zero transmission in New South Wales for a long time because people did the right thing. But when they came out, there was a lot of this idea that it was Freedom Day, that it was over. It was like the end of the war, and you could go back to the old normal. And that was wrong, because the only freedom that came with Freedom Day was the freedom of the virus to get on with the job that it likes to do, which is to infect the next person and the next person.
Look, watching the contagion bill in Victoria is extraordinary. We've watched a number of the Housing Commission towers put under enormous stress, especially for the residents. The government, without warning, closed them down. We're talking about 3,000 odd residents. And the incredible thing that we found out in doing a number of interviews with not only community leaders, but also people social workers who were working with residents in those towers, we kept hearing, we've been talking to government for months, we've been telling them we're vertical cruise ships, and no one was listening. What does that tell you?
Well, it tells me the people who are closest to the problem, the community workers, the healthcare workers, the public health workers, they know what their communities are thinking and need and want. And the idea that all of this wisdom comes from the top down in a press conference at 4 o'clock, okay, but we needed to spend a lot more time in the last few months putting together these very strong social communication structures and working with communities all over Australia to get the message out in the way that those communities understand. You know, that different communities receive messages differently, even though it's the same message.
We process. You're right. We process differently.
Yeah. So it didn't happen. Now, in the days of AIDS, Dr. Blewett, who was the health minister at the time, and his counterparts, they put the community right at the heart of the communications thing. I was the senior advisor to Dr. Blewett.
I remember.
And he told the health department and the rest of them, you do what these people want and say, not the other way around. They were very eager to say, do this, do that, as if they knew all what was going on, and they didn't.
They didn't.
So you put the community at the heart of it and mean it.
That campaign, you meant it, Bill. It was a tremendous campaign, and it did change not only the way we thought, but the way we behaved. Let's hope that people are listening and they can take some more advice. I'm getting there to process that the information you said to me is get all those social media experts who are talking in the different languages to the different groups and use them to drive the message even further than ever before.
Listen to the people and do what they want. Trust the people. I trust the people implicitly, but they've got to have the information that is correct and true, and they've got to get on with it and change behaviour, one family, one community at a time.
Bill Bowtell, thank you very, very much for taking time out of your day and importantly to give us some insight and some wisdom. And we certainly hope that all those professionals who are watching, who have tremendous capability, actually harness it and put it to good use. Thank you so very much. Bill Bowtell on The Informer. Thank you, Bill.